Justice also refers to the impartiality of treatment without looking at the patient's gender, race, sexuality, or wealth. So if a patient comes in and one of them is rich and the other one is homeless, you should treat them the same regardless of how they look. And triage is another example of justice where it's typically done during natural disasters or wars where many people are injured at the same time. And resources are finite. And so we rank the patients according to levels, with level 1 being the patients who need care immediately, whereas level 5 are patients that are barely injured and do not require our attention at that time. By distributing the resources in this way, we can maximize the amount of patients' lives that are saved. Next, we talk about a disclosure, which is a patient's right to all the medical information that you have on them. Family members do not have the right to ask the physician to withhold information from the patient, and physicians themselves, in most situations, cannot deny the patient the right to information, unless if the physicians believe that the psychology of the patient is unable to come to terms with said information. For example, if a patient who is diagnosed with lung cancer has a few weeks prognosis to live, if you believe that the patient may react badly to the information, you can withhold it for a certain amount of time, but in the end you still would have to tell the patient unless they request not to know, in which case you also have to respect their decision.